All right, good morning, everybody. My name is Mika, and I am a professor in the School of Population and Public Health here at UBC. I want to welcome you this morning to Voices in Health in my capacity as the interim director for the school. I want to let everybody know that this session is being recorded. That is currently underway already as I speak. I wish to start the session this morning by taking a moment to reflect and to acknowledge as a UBC and a school event that many of us gather today to learn on the beautiful traditional, ancestral, and unceded territory of the Musqueam people. Although I recognize that many of you are joining us from different locations in this virtual environment, and ask you to take a moment personally to reflect on the history of the land and the people where you are living and working today. In keeping with the land that UBC Point Grey campus is situated on as a place of learning for the Musqueam people, we continue in that tradition today with our Voices in Health speaker series, a series that brings to UBC external speakers to discuss topics in population and public health. And I wish to welcome Dr. Andreas Lopakis to the session today, who's going to share his experiences and reflections in his first year as editor-in-chief of the Canadian Medical Association Journal. I do want to just take this opportunity as well to thank Alex, Simona, Kevin, Stefan for helping organize this series behind the scenes and for all of their coordination to make this as seamless as possible. I'm now going to invite Professor Mike Law to more formally and in a fulsome way introduce our speaker and to moderate the rest of our session today, with our thanks also, Mike, for helping to organize and to facilitate this. So Mike, it's all yours at this point. Thank you.
Thanks very much, Mika, and thanks to Andreas for taking the time to be here. For those of you who don't know, Andreas has had a really long and storied career in clinical epidemiology and health services research, and more recently has had a strong interest in public engagement and dialogue. And I'm sure many of you have run across the Healthy Debate site at one point or another, and that site is the brainchild of Andreas over the past several years, and has arisen to a really prominent forum for debating ideas in our field over the past few years. More recently, in 2019, Andreas, is it the right way to say it, hung up the stethoscope and stopped his practice as a physician and took over as editor-in-chief of the Canadian Medical Association Journal, and that's the sort of pulpit from which he's going to speak to us today and give us some of the insight into what goes on behind the scenes. I'm always sort of personally amazed by Andreas's impact, particularly if I'm working as a CIHR reviewer or something along those lines. I'll often see these young clinician scientists from Toronto put submissions in, and I'll be scrolling through the CV, and more often than not, sure enough, there's Andreas's name in the last author spot. And he's created quite a group of really exciting young researchers in our field. So big kudos for that, and I'm really looking forward to his remarks. So Andreas is happy to take questions at the end, so please feel free to throw things up in the chat, or at the end we'll ask you to raise hands to contribute, and I'll moderate things after he's done speaking. So with that, Andreas, thanks very much for being here, and over to you.
And unmute myself here. Thanks, Mike. Michael, can you hear me? Just doing a sound check here. Yeah, okay. Let me go up. How do I get up on my slides here? Could someone just put my slide up one? I don't know how I was managed to get it into the third slide. If not, that's not a problem. I can do it from here. So thanks very much, everybody. I find these kind of talks sort of hard to figure out just sort of where to land. So I've tried to actually keep the number of slides to a minimum, and then we'll take as many questions as you have, and I'll answer them to the best of my ability. Just one kind of warning. Actually, my wife and I are moving house today, and I've just heard outside that the movers have literally come in and are going to be sort of moving furniture in the house, and hopefully we won't see them. Mika, your introduction made me reflect that actually one of the first things I need to do is I'm now sitting on 40 acres of land near Fergus, Ontario, which isn't that far from Guelph. And so one of the first things I need to do is educate myself about the First Nations people that were here and their history here. So thank you for that reminder. So, just as a tiny bit of a background, I've spent most of my clinical career as a general internist, last 10 years as a palliative care doc. I've done a lot of research myself. And as Mike mentioned, I think actually the thing I've loved the most in my career is mentoring young folks, which unfortunately in some ways you can't actually do as the editor in CMAJ, which is kind of, you can do it when you're editing a final piece, but not, I actually sort of, your intro made me think that or reminded me, Mike, that it's something I really miss in this job. But was fortunate enough to be asked to be editor-in-chief almost a year and a half ago now, without any thought that COVID was going to come along in about 5 months, to be honest, and it's markedly affected the journal as it's affected everybody. And I've really actually had, prior to taking this job, no experience. I've never been on an editor or an associate editor of a journal, so it's been a real learning curve for me, and I've just actually loved working with the people at CMAJ. So the previous slide said that CMAJ was founded in so I'm just going to give you a little overview, and then I'll stop, and then we can chat. So founded in
sorry, just to interrupt you, you're controlling the screen, so you can go back.
Yeah, it's weird. When I go, oh, hang on, there we go.
Sorry for the interruption.
Yeah, thank you for the interruption. There we go. So established in 1911. We publish weekly. So the official journal is the online journal every Monday morning at 7 a.m., 50 days a week. We shut down for 2 weeks over the Christmas, New Year's holiday. 50 days a week, there's a new edition of the CMAJ. There is a monthly edition of the journal that is a hard copy that is mailed to all of the physicians in Canada. That is a subset of what appears on the weekly official journal of the CMAJ. So the thing that keeps us going, and I have to say I had no idea what a treadmill, a weekly journal is. I just had no idea. That the official CMAJ is the monthly journal. Impact factor 7.7, that's been stable for the last 3 years or so. And, as researchers, I think, at least I used to always sort of think of the CMAJ as a place where I would send some of my research, particularly research based in Canada. And every weekly has one research article. Sometimes with COVID now, there's 2. But research is a definite part, an important part of the CMAJ. But I think it's important to understand that it is only a actually relatively small subset of the CMAJ. So we do publish editorials. My own view is I've published relatively few. If I look at editors, the editor of the New England Journal virtually never publishes an editorial. Paul Hebert, when he was editor of CMAJ, published a lot. I'm on the not publishing so much thing. I was selected in a dark hotel room to be the editor of CMAJ in the Sheraton Airport Hotel. And like nobody elected me to pontificate, at least that's my view. There have been a few things that I've thought strongly enough about that I've written an editorial, but I've taken the tack of not writing a lot of editorials. There are then 2 sections called commentary, which I think in some ways is a slightly misleading term, and analyses. So commentaries are 1,000 word, 10 referenced opinion pieces about a particularly controversial clinical or policy topic. They have to be referenced. They're different from an op-ed. So, you know, they're not a kind of call to action with no evidence behind them, which I think a lot of op-eds in the Globe and the Star sometimes are. They're sent for peer review. And I just looked to see what the topics of the last 4 were. And one of them was relaxing the no visitor policy in hospitals during COVID. But it was quite different than an op-ed that might appear, because the authors reviewed the existing literature around the likelihood that COVID was to spread from visitors to staff and vice versa. There were actually some studies down in the United States. So that was one, relaxing no visitor policies during COVID. The second title was No More Waves, Strategy for Managing COVID. The third was transforming race-based health research in Canada. So a call actually for the CHR to have an institute of race. That wasn't the term they used, just like they have an institute of gender, for example. And then the fourth one was non-neutral, recognizing anti-racism as a professional competence. So arguing that advocacy should become, and particularly advocacy against racism, should become a professional competence of physicians in Canada. So there's 4 commentary topics. Analyses are longer than commentaries. They're 2,000 words as opposed to 1,000. You can have 25 references. And the last 4 titles I have from analyses are Advancing Gender Equity in Medicine, Mandatory Vaccination for Healthcare Workers, Analysis of Law and Policy. This is mandatory vaccination against COVID. Integrating Research into Clinical Practice, Challenges and Solutions. And finally, the 4th one, Managing Conflicts of Interest in the Development of Health Guidelines. So those commentaries and so those are 2 distinct sections, and every weekly CMAJ has at least one of those 2, if not 1 commentary and 1 analysis. Then there's a fairly large practice section that has interesting images. Clinical images are often radiological or dermatological, interesting cases. There's a 1-page 5 things to know about X, 5 things to know about thalassemia, for example. And then the section that isn't used that often called innovation. So Dorian Deschauer manages that practice section, and there's usually a couple articles and that are really largely aimed at practicing physicians in Canada. Then there are clinical reviews, for example, what's the evidence for using sunscreen? And guidelines. Often there was a guideline on the management of obesity that was published in the CMAJ the last year, for example. There's a section on medicine and society, an article that argued that William Osler made many racist comments actually during his time, was a particular example of an article that appeared in Medicine and Society recently that was read a lot and was quite controversial. And then there's a humanities section where physicians or patients sort of reflect upon an encounter that they had in healthcare and what that might mean for healthcare in general. And then we do have 2 journalists that work at CMAJ who publish basically sort of news articles, 2 to 3 a week on CMAJ. So those are the sections. So, you know, you folks are probably more familiar with the research, but many of you may want to submit commentaries and analyses on topics that are of interest and that you're passionate about. A couple of just slides about, this is sort of some slides we did internally to sort of see how 2020 was. And just ignore, I apologize, there's some data on CMAJ Open, which is irrelevant for this talk. But if you look at the figure at the top, you'll see that we had like an unbelievably busy 2020. So one of the things that struck me about COVID was that, if anything, we got more non-COVID articles in 2020 than we did in any of the previous 3 years. So Many of our clinician researchers, especially those that worked in ICU or emerge or general medicine, were very busy clinically with COVID, and therefore I think the likelihood that they were going to submit something to the journal went down. But maybe people like Michael, who aren't clinically active, might actually have more time to write up stuff. Write up stuff and submit it to the journal.
I have young kids, Andreas. That didn't help.
No, okay.
Yeah.
But you'll see the in gray there, the increase in articles that are not related to COVID, and then just like from 0 to around 900 articles on COVID during the year, which meant that basically, actually for about 3 months, from April to June, we all thought we were going to die. I mean, honestly, it was just the volume coming in, and this is on the basis of no capacity to increase staff, no capacity to publish more. It's just sort of managing this incredible, for us anyway, increase in volume. Because for those 3 months, I think the volume was up about threefold. It's gone down since. You can see, actually in 2021, we are still getting quite a few COVID articles. But bottom line, marked increase in submissions at the CMAJ, and you got I can't see my whole slide because Michael's face is right over it on my computer, but I think it's something like an average of 7 to 8 submissions a day, which, if you think about it, that's a fair amount of work to manage those. And this should be, I think, no surprise to you, but pretty well every submission, it doesn't matter what it's in, whether it's humanities, medicine, society, research, is reviewed by at least 2 editors internally who make a decision about whether to send the article for peer review. Obviously, with 8 articles a day, there is no way we could, or our reviewers could, review all the articles if we sent them out for peer review. So my guess is we probably turn down, and we use the term intercept, probably about 70% of the articles at this point, where we just think this is not for us either because of the topic, or we don't feel it's novel enough, or for a variety of reasons. If it is sent for peer review, we try and get at least 2 peer reviews per paper. Quality of the peer reviews, just like at the CIHR, varies. And then those reviews come back, and then there's a meeting of usually 3 to 4 editors. If it's a research article, there's always a statistician who, almost like a CHR grant review panel, look at the papers that have come to the group that week, look at the external reviews, and then make a decision about whether to, very rarely do we accept anything without any revision, so whether to go back with a revision or to reject at that point. And then one of the, if it is on the way to acceptance, and one of the editors works with the authors to finalize the manuscript. So I don't think there's probably anything too surprising there. If you look at the top left-hand corner there, not surprisingly, given that we had a marked increase in submissions and no opportunity to publish more, we rejected, or actually, turn it around the way the slide is, we accepted a lower percentage of articles in 2020 than before. And so you can see 6% of research articles submitted to CMAJ got accepted, 16% of articles that were submitted in the analysis category. And you can see that's a marked decrease from the 27%, or if you look at commentaries, 46% in 2019 to 17% in 2020. So again, a reflection of the volume and the inability to publish more. This is an important slide. So one of the things we did, I was fortunate enough to do in January 2020, was to bring down the paywall. So previously, research articles and editorials and guidelines and news were freely available to anybody. But the rest of the journal was behind a paywall that you either had to pay for, or you got access free if you're a member of the Canadian Medical Association. And I really felt, as did the editors before me, that we want, especially analyses and commentaries are often on sort of politically important, policy relevant issues, that we would want readers widely to be able to read them. So the paywall was brought down, and you can see that between 2019 and 2020, we have had a more than 3. Now this is not impact factor. This is not publications. This is not citations. This is simply the number of people that looked at articles on the CMAJ website. And you can see that there's been a marked increase, like a 3-fold increase from over 1 year, which we were very, very pleased by. We were pleased that we brought down the paywall, but intriguingly, that increase didn't just occur where there used to be a paywall. So you can see that the number of reads of the average research article of CMAJ went up considerably, even though the research articles were previously freely available. So like my take is the paywall coming down obviously made a difference. I think some of this may be COVID-related articles are being particularly highly read, but I'll show you in a second that all of our most highly read articles were not COVID. And I'd like to think maybe that there's a bit of an increase in the quality of the stuff that's a bit more interesting to people than before, and so more people are reading it. But that we have not done a survey or a qualitative piece of research to sort out the right reason for that, but we were super pleased when we were working like crazy. It's actually super gratifying to see that work looks like it's worthwhile. So here's I'm going to show you 3 slides of kind of different ways of looking at, and again, this has nothing to do with the number of times articles are referenced. We'll find that out in a year or two. But these are the top 10 articles published in the CMAJ in 2020, and the ones that were read the most online. And obviously ones that were published in November have less time to be read than the ones that were published in January. This isn't a scientific thing. This is just a sense to give us a sense of what are people looking at. So you can see it's a variety of things. The Obesity Guideline was a massive piece of work actually, and was read a lot. Peter Uni and colleagues did a article fairly early on the COVID, just around the time many governments in Ontario and Canada were trying to decide whether to let kids back to school or not, looking at the impact of different public health interventions across the world. I did a sort of a meta regression analysis on COVID-19. There was a article on, again, this came out around the time where there was a great lack of PPE. So a lot of hospitals were looking at how, and nursing homes actually, or long-term care facilities, on how to repurpose respirators. And then something that had nothing to do with COVID at all, an analysis looking at the link between smartphones, social media use, and mental health in youth from a group of youth psychiatrists. Then a kind of clinical pharmacology thing around the time that Trump was suggesting hydroxychloroquine might be an answer. A practice piece, a couple of kind of modeling studies of COVID. Actually, interestingly, I think the first time in a long time that a letter had been so cited around transmission of COVID on an international flight that was early on in the COVID outbreak. And then actually an example, sometimes there's just an image or a case that strikes docs, a very striking image actually of a skull abnormality of a newborn that was read 43,000 times. This one actually, so e-talk, all CMA members, I should say CMA members of talk, not CMAJ, get a weekly email on Monday morning saying, here's what's in the journal, and they can click on that. And so this is just like the docs that actually directly clicked on that email. And it was intriguing to me that the kinds of things that they clicked on, the docs, was, I think, qualitatively different. Like number one was actually a review that was published only in November, so it hadn't been on the website for that long, which just struck me as you know, it's sort of a practical thing for docs who are in practice. Similarly to actually, how do you interpret this international asthma report about the use of inhaled steroids? And the one policy piece that made it in the top 10 that the docs are immediately clicking on was the final one, closing the gender pay gap in Canadian medicine. I think it talked to like docs working in hospitals or working in primary care to sort of say, what can we do about this particular issue? And actually the other policy one that was striking to me was, where is it? The fourth one, the relationship between surgeon age and post-operative outcomes. Again, a very common policy thing that docs working in hospitals would be struggling with. Like, when do we tell a surgeon that he or she can't work anymore because they've gone past a certain age, or should we even do that at all? And you can see the William Osler article in the humanities section made it in the top 10 of what physicians were clicking on. And then here's sort of what the media, I'm embarrassed to say that I didn't make this slide, so I can't tell you what the significance of the 3 yellow horizontal lines is, but here are the things that the media looked at the most. And again, it's different. And not surprisingly, they're interested in surgical backlogs with COVID. There's a paper from, hang on, I don't know. There's a paper from BC actually about the change in causes of overdose death in BC. You can see that medical assistance in dying, for example, is great interest to the press. So the reason I showed you these 3 is one of the things that's kind of fun being editor at CMAJ, but also challenging, is I think we have a number of different kind of, I don't know whether niches is the right term, but we have a number of quite distinct audiences. I think we have practicing docs. We have people that are interested in policy. We would have people in public health units or in ministries of health that are interested in more global, but more broad policy issues. And then we have researchers who are maybe just interested in the research. And it's a fun challenge to actually be editor of a journal that has those different kind of readers. And I'm always kind of aware of wanting to put stuff into each weekly that there's something in there for each of these 3 or 4 important readers of ours. So I'm almost done. I think this is the second to last slide. I mean, obviously you folks, or I'm assuming most of the people that are on this Zoom call are hopefully from time to time reading CMAJ, but hopefully from time to time submitting stuff to CMAJ. And this sort of thing about, factors that make a submission attractive, and this is my slide, so me only, and I'm not so much talking about research, where it's interesting. I find it much easier to review research articles that come in. You can kind of look at the methodology. For many of them, there's sort of a standard methodology. For commentaries, for humanities, I just find it a lot harder, actually. And so I initially, when I did this slide, I had things that lead to us rejecting an article, and I thought, no, Andreas, that's really, really negative. So I've flipped it around, actually. So if you're submitting a commentary or an analysis, for example, I mean, it's easy to say, but it needs to be engagingly written. Like the number of articles we get about COVID that spend the first 3 months telling us that COVID started in Wuhan and it spread around, and the WHO declared like, we know that. Like, you need one sentence, like, just get to the point. If I had like that's one really important suggestion, I think. So don't need some great big long introduction. It should be engagingly written. I think a clear and relevant hook. One of the analyses that I mentioned to you was an article from Francois Champagne and colleagues in Sherbrooke, who talked about how Canada might do a better job of integrating research into clinical practice. And the hook there was the fact that in the UK, they, in I think about 8 weeks, randomized, like, I forget the number, but something like between 10 and 20,000 people with COVID to steroids versus no steroids. And 3 months later, they had a definitive answer that steroids save lives. And when I read that, I went like, oh my God, that is just the most friggin' amazing thing. how the hell did they do that? Like, it would take us that long in Canada to get the research ethics boards to approve the article, let alone do it. And so that was the hook. Like, we in Canada are using evidence generated in the UK in a matter of weeks. Why the hell couldn't we do that? So I think those sort of hooks are really, really important. We do get a lot of articles that we turn down, frankly, because things have been said before. Like an article that says that poor people are more likely to die and have many more diseases. Like, honestly, it's true, but it has just been said so many times, and with limited ability to publish, we want to publish stuff that either takes a new look at it or provides a new take. I personally have a bit of an allergy to articles that talk about, we need a strategic plan for dementia. We need a strategic plan for poverty. Like, okay, but exactly how are you going to move those goalposts forward? And mostly, at least in my opinion, it's usually incrementally. So I think if you're writing a thing about, there's a major issue that we in Canada, and it doesn't have to be Canada, but if it was in Canada, need to deal with, having clear and specific points about how we get there is really, really crucial. And not just a general call for action because X number of people in the country have this particular disorder or are at risk for something. And as I mentioned, sometimes we do get commentaries that really read more like an op-ed at a newspaper. And frankly, if you're writing an op-ed, I just send it to the journal. Like, it's not going to be peer reviewed. You'll get it out there immediately. It's a lot less headache. You know, we would expect our commentaries, which are the closest thing to op-eds, to be like you can have a strong opinion, but you got to recognize that often there are opposing views that have some degree of legitimacy, and you need to get into the CMAJ, you need to acknowledge those and address those. We often do like to see, you know, international evidence about if we're not doing it in Canada, and we should be, are there other jurisdictions that are doing it, and what have they done? The timing has to be right. There's some things around COVID that, you know, around, for example, like what subgroups of people should we vaccinate now? I think those decisions are happening so quickly that by the time it will go through a peer review process in CMAJ, it's going to be old. And you'd be better off talking to the media about it, putting it into a policy brief that goes into the government, et cetera. We feel badly saying no to some of those, but sometimes it's frustrating for the author and frustrating for us, actually, if it goes through. And even if we do sometimes ask for expedited review and we get reviews back in 3-4 days, it's still a 2 to 3 week process to go through it. And so some things that are super, super timely, CMAJ, aside from our news section, might not be the place to go. And then, you know, we are a national journal. We're not a super subspecialty journal. We do publish some specialized stuff, but I think if the topic is likely to be of broad interest, it's more likely to be accepted in the CMAJ. And clearly, if we've published a lot on, I mean, we have published recently quite a bit on anti-racism, and that's a conscious decision of us as editors saying this is an important topic right now, but the material we're publishing takes different and unique approaches to it. But in general, if topics have been covered a lot recently, again, because of the limited space we have, we might say what you're submitting is not sufficiently different from what we published a year ago for us to want to move forward with this piece. You know, all of these judgments are subjective. I'm sure we've all made many, many mistakes along the road. The one thing that does allow me to sleep better as editor-in-chief of CMAJ than when I used to chair the randomized trial committee of the CHR is that I know if that we turn something down, there's like 1,000 or 2,000 journals out there. Like it's not like people can't get their stuff published. Well, when I used to chair the randomized trial committee of the CHR, if it was a randomized trial of, you know, an intervention that a pharma company wasn't going to fund, and it was a big one, if we didn't fund it, almost nobody was going to fund it. And so that really was almost a kiss of death for that grant, which made me feel terrible because we could only publish, or the CHR could only fund a small amount of them. At least here, if we screw up and your brilliant idea doesn't get published in the CMAJ, you'll be able to get it published somewhere else. So final personal thoughts. You know, the variety of the CMAJ is great fun. I'm sort of a generalist, so I just enjoy reading all the wide variety of topics and takes that come in. Working with authors is usually fun. I mean, sometimes they're kind of annoyed, but usually that's fun as well. The one thing I dislike about the job is saying no all the time. Not all the time, but most of the time, to be honest, like a lot of the time. And it just gets wearying after a while. I mean, some of the stuff definitely we should say no to. But you know, there's a lot of good stuff that you just got to say, like, I'm sorry, but we have to make a decision around weighing this one versus that one, and we're going to go with that one. And that doesn't feel good, to be honest. But as I said before, at least there are other journals that people can be sent to. And the final thing, which is a little plug, we have a year-long position, and with COVID, the person definitely doesn't have to be in Ottawa, of a CMA for a editorial fellow at CMAJ, where the editorial, they're often people who have finished residency or fellowship and might have an interest in working in a journal in the future, and they kind of are mentored and participate in all aspects of the journal, and you know, reviewing articles, being on the meetings, etc. And our current fellow finishes in July, so we've got an ad up on the Canadian Medical Association website. So if anybody listening in or watching in here might be interested in applying for that, please do. So, Mike, that's it. Thanks.
Great, thanks so much, Andreas. That was really interesting, and I appreciated seeing some of the statistics from the other side of the ledger. So on the agenda, I'm supposed to give some thoughts here, but I actually would much rather hear yours, and I suppose everyone else probably would too. So I have a bunch of questions that people have posted. Please feel free to put a question into the chat if you would like to, and I'd be happy to ask it, or put your hand up if you'd like to ask it yourself right now. But just to kick off, I wanted to ask you, just in general terms, since you've come from the world that most of us inhabit, and are now on the other side of the docket, what do you wish you knew when you were in our shoes, when you were as a researcher trying to get your work published and trying to get your work out there? What do you think the most important lesson that you could give us from the other side is?
Yeah, it's a good question, Mike. I think in terms of how I mentored people in submitting material to a journal around the research, to be honest, when we review research articles, it feels very much like reviewing research proposals around the CHR. It's not that different. I think around submitting analyses and commentaries, it would be the jump almost immediately to your main point. To recognize that actually like when you look at what is read a lot and what isn't, I mean, I just gave you the top 10, but a fairly dry analysis around of a particular topic, and it's hard to articulate what makes it dry and not, but that business of a hook and why this is really important without making a bunch of bullshit up, but like, why is this important now? And you really should read this, I think, is really important. And I probably didn't put enough attention to it. And no need to review, turgidly, like 3 to 4 paragraphs of introduction. I think the way I actually used to write scientific articles is kind of the way I edit. I like people to get to the point and just sort of dive in. And then the final thing I think would be that business about if it's around strategy or new initiatives, about trying, it's a tricky balance of trying to be as concrete as you can. Like saying that we need, I'm just using dementia, but saying that we need a new approach to dementia, like everybody knows that and everybody's been talking about it for 20 years. I think we would be much more interested in something that said, in Canada right now, these are the three things we're doing pretty well. These are the three things we really suck at. And by the way, there's a couple other places that do this really, these things very well. Don't forget to talk about costs and stuff like I'm particularly looking at not pie in the sky. I'm looking at stuff that's actually maybe be read by someone in the Ministry of Health or the Ministry of Social Services in BC, and sort of say, oh, this is something that would be relevant. So trying to be as specific as you can without getting into micro details about steps, I think, is really important. I kind of roll, this is personal, but I kind of roll my eyes when I see a kind of general strategy, because it's really easy to say, but it's those things that need strategies, probably need strategies because they're hard to do. And if they're hard to do, we got to roll up our sleeves and start incrementally, usually, I think.
That's great. So I'm going to go to our audience here. And so one of the first questions that got sent in was a question about compensation or not compensating peer reviewers, and how you see that at the journal, and you know, even and I'm going to take my prerogative to extend it beyond there and ask you, you know, how you feel about the peer review model in general, and what you might modify if you were well, actually I was going to say if you were in charge, but you are in charge, so there's the question.
Okay, so in terms of the dollar, I mean, we do pay our associate, so we have a number of associate editors, so those are the internal peer reviewers, so that we would send research articles out to review. We pay them on an hourly basis because they work for the journal, not as as contract folks. But like peer review, like Michael, if we sent you an article to peer review, just like the CHR doesn't pay peer reviewers, we don't pay peer reviewers either. We are working pretty hard on trying to get a stable of patient peer reviewers. And we actually, there's a special kind of case that's going to appear in the practice section that we're tentatively calling the 360 case that will be written. There will always be a patient that writes part of that case, and we want patients to review it. My view is that we should pay patients to review those things. And the rationale is that you and I, Michael, sort of part of our job. We may think we don't get paid as well as we should, but part of our job, part of our, you know, we put it on our CV, we review articles, that's how we get compensated. If someone is a school teacher and agrees to do a review for CMAJ, that's not part of our job, and we should respect that. So we will be paying, we haven't exactly decided what the price will, but we'll be paying them. In terms of the peer review, I mean, like it's like, I guess, you know, what Winston Churchill ever said about democracy, like it's not great, but it's better than having Trump being in charge. I guess he got in there through democracy, so maybe he's going to screw that thing up. But you know, I think we get great peer reviews. Like I'm just amazed by the quality of some of the peer reviews, and we get peer reviews that are 2 sentences and superficial. The latter are a real embarrassment for us. They're a real problem, because when we go back to the author and say, actually, we've considered your article and we had an internal discussion, and you know, there are 2 external peer reviews, and one of them is a 1-sentence thing that says this is great. You know, it doesn't look, and authors then often say, well, shit, you got a great review. Well, we got a positive review. We didn't really get a great review. But, you know, we probably select, when I'm selecting reviewers, when I'm on, it's my turn to be selecting reviewers, we probably sort of select about 15 reviewers, and we'll be lucky to get 2 or 3. And, you know, I was like that when, you know, when I guess the more senior I got, the more fussy I got, to be honest. I would usually review for JAMA and Lancet, and if CMAJ came along, I would, because it was Canadian, I would review for CMAJ, but there were times when I was just too busy and I'd say no. But a lot of people say no. So I'd say and there's a subset of really great reviewers that review for us a lot, and then you feel kind of badly going out to them again, right? Because you think, oh shit, so-and-so's, just done a really great review for us 2 weeks ago, and now we're going back to her again. So, but I'm really glad we do have the peer reviews because, given the variety at the editorial office, we're not experts in like 99% of what we get. So we really do rely upon those reviews, and if we get two what we would call bad reviews, we'll actually usually wait and just go out again and sort of say, like, who could we get to review this that would really give us a decent review, because we need one good review. And so we would wait for those.
Another question from the audience here for you, Andreas. So what impact did taking down the paywall have on the finances of the journal?
Yeah, I should remember that, but the journal was able to, I think it was around the Canadian Medical Association Journal, who pays most of the freight for CMAJ. I think they took about a $600,000 hit per year. And the reason was that the stuff that was behind the paywall, when docs could click on, there could be an ad for, it doesn't have to be a pharma company, but for something for the, and particularly pharma ads obviously can't be, in Canada, can't be aimed at the public. So as soon as it's publicly available, they lost all those ads. And then there were also it's a whole new world to me that I still don't understand. The aggregators, the people that would sell, the companies that would sell the CMAJ subscription to libraries because it was behind a paywall. Now it's not behind a paywall, so no library is going to be willing to pay for something that's that's not behind a paywall. So I'm pretty sure I'm not far off. Please don't tweet this out or anything. But I think it was around $600,000 a year, and that's going forward. So it was, to their credit, they felt obviously strongly enough that they were willing to make that financial sacrifice.
Mm-hmm. That's great. So a lot of people are direct messaging me questions, so I'm just going to keep asking. To what degree do you prioritize Tri-Council funded or other or Canadian studies versus other things that you might receive?
Tri-Council funded we don't prioritize something that's funded by the CHR or whatever. I mean, the research should stand on its own. We don't prioritize where the author is from, although if there was a health services research article that was really well done, but it was done in a country whose healthcare system is so different from Canada's, we might actually put that lower down in our priorities. And if something almost similar, or the same thing came from Canada, we for sure put the Canadian one higher, not because of the methodological quality is different, but because the relevance to our readers is different. But if someone in another country submits a really excellent piece of research that we think is of relevance to Canadian readers, the fact that they're not from Canada wouldn't make a difference.
Mm-hmm. So another comment from the audience. Shortly before I left last year as an editor of an international journal, we were reconsidering the best way to assess the impact of our published articles, things other than the usual citation speed and number statistics. I'd appreciate your thoughts on the best ways to measure this.
Yeah, that's a really great question, and you probably know that I'm not going to have any. I think it's multifactorial, to be honest, depending on the parts of the journal. So, only certain parts of the journal make it into the impact factor, right? It's the research part and analyses. And with those, I think impact factors, not a bad metric. Like if nobody's citing the stuff that appears in CMAJ, there's a problem. Now we all know that, we don't publish randomized trials very much, and those get published, especially the big impact trials do. So I think looking at impact factor, and I think probably more than anything else, social science and medicine publishes great stuff, but their impact factor is low because they're just not cited as much as social science. So I think the thing would be to look at what's happening to the trend of the impact factor. And if it was really going down, I think that would be concern. If it was going up steadily, I think we would feel good about that. But I think there's, you know, there are, like within the practice section of the journal, eyeballs on the practice would be really important. And then some of the qualitative stuff, like you hear that certain cases are kind of used by emergency medicine profs to teach emergency medicine to med students. I mean, how you measure that, I don't know, but you know, so impact factor, readership, some kind of qualitative assessment of, you know, every once in a while we'll get an email from an article saying, you know, thanks for publishing that thing 2 months ago, and actually, you know, a policymaker in our region, I was able to show it to them and it made a difference. So those kinds of things. But I think it's a multifactorial. What's for sure, if nobody's reading it, then I think we're probably fairly safe grounds to say it's not going to have an impact. You know, one of the things we probably should do, having seen that large increase in readership, would be to, part of the problem of being on this treadmill is you just don't have time to sort of step back and sort of say, okay, let's design our own little study and do a survey to figure out, you know, different, how we're doing on these various metrics.
I'm going to ask a sort of a follow. I'm going to follow up here with something of my own. There's often this perception that, particularly amongst the big medical journals, they like to publish things that are going to be newsworthy. And I know that you know, you guys obviously have a media team. I've worked with them before, and you do a weekly release. And I wondered how much media factors around media coverage drive editorial decisions, and then I guess as a follow-up to that, what role do you see the media as playing here, and in sort of promoting the journal, but also in you know, emphasizing certain articles over others?
Yeah. I think I can honestly say that we don't sort of grab an article because we think it's going to be on the, you know, front page of the Globe, etc. Because that's actually often very. I often think those of us I won't say who it is, but someone who publishes a lot of op-eds, quite a lot of op-eds, who's a very thoughtful researcher. So policy clinician said to me the other day, they said, you know, I actually think that we overestimate the impact of op-eds, and the impact that of mine, I just don't think are that great. I feel good about them getting into the newspaper, but if they get into the Globe, they're getting to people that already think the way I think and read it. So I think sometimes we and you know, like I used to run a research institute at St. Mike's, and so don't get me wrong, we were very keen to get media coverage, but I do think we sometimes overestimate the impact of that on actual change, and it is very, very, very ephemeral. There's some articles that are published in the CMAJ where we look at, you know, what are the most read articles in 2020. There'll be a few in the top 30 that were published in 2014 or something. And that doesn't happen with you know, an article, a media article, right? It happens and then it's gone. So I think we are gravitated to topics that we think are really timely and might get media interest, but might just be really of interest. And some the stuff that's super topical, those are the things we might say to our to Lauren Vogel, our journalist, sort of saying, Lauren, maybe you want to cover this, right? And what's the role of, well, I think media obviously does disseminate a lot of our research, but as I say, I think they do it for a relatively short period of time. Now that's different than someone like Andre Picard, who kind of, my sense is, sort of internalizes the evidence he's getting and then uses it in pieces that he writes maybe years later. But if we're talking about the usual media is, hey, Michael Law's done this study of extra billing in Quebec. What's that say for kind of extra billing in the rest of the province? Most media, that'll be a 2-day thing and it's gone. Now you will use that article by going to your policymakers and stuff, and I think we'll be able to say, hey, this was peer reviewed, and therefore it might have a little more impact, but not because of what it's done in the media.
So I was going to ask you what perhaps is a little bit of a cheeky follow-up there. You said the Globe, if you publish an op-ed in the Globe, it's reaching people who don't really think differently from you. Do you think that an article in the CMAJ reaches people that that think differently from me?
No, and I think that's actually one of the things that I struggle with. I mean, first of all, the research comes in and it's largely, we make decisions largely on methodology. But around the commentaries and analyses, and you mentioned healthy debate. When I started healthy debate, I was sort of desperate for some really well-written right-wing articles, frankly, that I might disagree with, but are so well-written that I'd have to look at and go, well, you know what? They haven't ignored a whole section, and that's really important. I mean, am I under any illusion that the average public is reading the CMAJ? No, but yeah, I think the people that are reading the CMAJ are probably more into the policy realm and the practice realm in Canada, and that's a subset of folks. So if I was trying to reach the public, I think reaching it through the media would probably be a better way. But again, it's just going to reach them for a very, very brief time. Around your particular article, for example.
Sure. So I'm under strict orders to wrap up by 11:30 here. So I'm going to ask you this last question. I think it kind of builds on the last question that you've asked here. So someone has messaged me whether CMAJ would be a good place to publish on controversial topics where the message goes against the status quo. And I think you've just given a prelude to the answer.
I think, I think we would love controversial. I mean, the William Osler racism piece. I got a lot of letters that weren't published in the CMAJ about that one, I think that one was controversial, no doubt, and we realized that. But that was heavily, that was thoroughly peer reviewed by some historians to make sure that the Osler quotes, etc., were, it got full, thorough peer review. So we didn't back away from publishing that, even though I knew that in some circles we would get a lot of positive feedback, and others we would get negative feedback. So the controversy is not the issue. The issue would be we're unlikely to publish something that only takes one side of something that most people would say clearly has two sides. We do have a blog section where we edit them very lightly, and they're not peer reviewed, and so we're more likely to, something is more likely to get in there, but probably not read as much.
Boris, do you want to wrap us up with something quickly?
Yeah, very quick question. So thank you very much, Andreas. Good to see you. Can I ask you to summarize in one sentence, what is the purpose of CMAJ?
To provide high quality, evidence-based, useful information about clinical practice and health policy in Canada.
Perfect, thank you.
Great. So thanks, Boris, for that question, and thanks to everyone else who submitted. And
how about me for answering that in one sentence?
Well, I was just about to do that, Andreas. You cut me off before I said that. Congratulations. So yeah, thank you very much, Andreas, for a very precise one-sentence answer and a very excellent talk to surround that one sentence of glory that you provided at the end. So with that, I'll pass it back to Mika to close us out.
That's a great note to end on, a nice one-sentence succinct summary. So on behalf of the school, Andreas, I want to thank you very much for your time this morning. I know you had competing demands in the middle of moving, in the middle of pandemic, with the demands as the editor and personal demands. I really want to thank you for making this happen. I think Mike's opening comments said it well. It was an interesting perspective that I don't always get from the other side of the journal, and very informative to think about it from your perspective and some of those statistics. And I note online, I think we have a lot of some students participating, and maybe some of our younger faculty, and I think really helpful as they think about publishing in journals from their perspective. So on behalf of the school, thank you very much for your participation today and for those insights. Thank you again to our organizers. And with that, I wish everybody a good rest of your day. And enjoy the sunny weather on the West Coast if you're out here. Thanks very much.
Thanks a lot. I really enjoyed it. Thanks for having me. Take care. Bye-bye.